not something that's come up in our public health subgroup in terms of, well, it's come up, but I mean in terms of something that we moved forward as a strategy. I can tell you that organizations that are members of the working group, like the Maine Public Health Association, for example, support that, but it has not been something that we've focused on in terms of prioritizing it as a strategy. If you have suggestions for how we could, I'm trying to think of how we could do that within one of our 4 existing strategies, which are surveillance and monitoring, public education, high intensity weather impacts, and health systems. Maybe with the education or the health systems, it could fit in there as a recommendation. Do you have suggestions for how we could do that? We can't add a whole new strategy, but we certainly could add it. I'd have to talk with the working group members, but we certainly could add it to one of those existing strategies. Okay. And I'm also happy to talk with you separately if this is a difficult way to communicate.
Becky, did you have a question? I just unmuted you.
Typed it in. I typed it in.
Oh, okay. Do you see that, Becca?
So,
I didn't see Becky's.
okay, so it's in the chat. Can you hear me?
I can hear you. Yep.
Okay. I know that in some of the other areas, it has been discussed, a green bank, which Connecticut has one, and there's some others that David Gibson has proposed along with Ziegler for a legislative bill. And the green bank would be funded in part by the state, hopefully soon the public employees retirement fund would jumpstart the fund, but the idea would be to make communities more resilient by developing a way for low-income folks to actually insulate their houses, weatherize their houses, and participate in the renewable energy economy. But it would be a way to keep that money in Maine. So and looking at the public employees retirement fund would be divesting from oil. So and they had, in January, they had $1 billion or more in the in the fossil fuel industry in their retirement fund. It's probably down around 700 million at this point, but that's just a big chunk of change that we could be leveraging to get private investment to support that kind of community resilience strategy. So that's one thing that I'm a Sierra Club person, and we are actively working on that particular avenue. So I just want to make sure that that had been presented in the community resilience.
I'm really glad that you flagged it. We have not talked about that in the public health subgroup. No, in the subgroup. But that's because we're not looking at funding mechanisms.
Okay.
I will check with Judy and with Annie, who their subgroups, the emergency management and the community resilience planning, they've focused on funding mechanisms. So I will circle back with them and make sure that that's on their radar, because I agree with you. I think that sounds like a promising.
It's a significant public health issue. We've done some work in some elderly housing in the past and worked with CAP agencies to identify folks. But I think it's a really significant opportunity for us. And I know this is a horrible time, but I actually think that our opportunities are vast if we, if we are brave enough to move into this, I think, we have a great opportunity.
Yeah, and strategic, I think. I mean, we certainly can have greater investments in public health and economics and addressing climate change. I mean, I think there's an opportunity for intersection there.
Well, they're all so interrelated. So,
Yep.
So, okay.
Yeah, thank you. I'm really glad that you brought that up. Thank you.
Okay.
Let's see.
Oh,
there we go. Oh, we hear you.
Hey.
Good. Yay.
Yeah. So like I sent you, I DM'd you some stuff about why I thought the healthcare stuff was important, but I'm about to go into a little bit left. So like community resilience is like it's not just like about providing like strategies to like in my view anyways, it's not about like providing merely strategies to like mitigate the worst effects of climate change, but it's also about like uplifting those communities in general. And since like right now we're not currently envisioning an economy without people who work in service industries, what are you doing to ensure that like, you know, folks who work in like say the restaurant or the tourist industries are receiving like livable wages and like systems in order to like dodge the worst effects of climate change? Because it's like living in Portland as like a working class youth of color, like it like I lost my job because of COVID, and like if that keeps happening because of climate change, it's gonna just like it fucks me, but it also like harms it every time that like I'm injured by any of these catastrophes and like other communities are injured by these catastrophes, it harms us for generations to come. It creates like this generational damage that like removes wealth from like our descendants.
Yeah.
Yeah.
The way that we've been thinking about it is the way that I presented it, which was around helping communities with like ordinances and zoning and things like that. We talked about in the public health subgroup psychological preparedness for when there is a climate disaster and to prepare people for those effects. But the way that you're characterizing resilience makes a lot of sense. And I think that there is room for us to think about how we can incorporate, I don't know, what strategies do you think we could be considering? I think that the way that you're talking about resilience would fit actually probably within the public health subgroup more than the resilient planning group. But what ideas do you have for different strategies that we could consider?
I mean, in talking about healthcare, like I think separating it from being like necessarily like on the employer to give it to people, because like when climate change and climate disasters happen, sometimes businesses go under and they can't provide
which is what's happening now.
And it creates like these knock-on effects, like, you know, if I lose my job because of a climate disaster and I have cancer, or if I lose my job because of a climate disaster and like I catch a disease or like I'm harmed in some way, like it's going to be nearly impossible for me to escape that like crippling medical debt. And as well, like, you know, like if I live in a neighborhood that's going to be underwater in my generation, like that implies that I'm going to need, like, if we're currently living under like the current systems that we live under now, I'm going to need the like capital, the money in order to relocate. And if that like, and if I can't do that working a minimum wage job, or even like as somebody who's like jobless, like how am I going to be like able to like move away from these incoming disasters?
Yeah, no, I agree. And so on the one hand, it's supporting recommendations that advance jobs with wages that are livable, because one of the issues that we have in Maine is not just unemployment, but it's underemployment. I mean, it's to the point you were making around the service industry. It's people who are working and they're working multiple jobs and still not able to make ends meet. And so when there's a climate disaster or COVID and they lose one or several of those jobs, I mean, you're right. It's really difficult to try to crawl out of that. So it sounds like one is for us to be more explicit about supporting other strategies that advance green energy jobs, but that are, or green jobs, I'll use that term more broadly, but that have a livable wage. I'm trying to think about how we can connect rural or even urban. I mean, it can be Portland, Bangor, or Lewiston, Auburn, but like healthcare access, because with the health systems, we were focusing on emissions and preparedness planning. Like one of the examples somebody gave in our group was hospitals' backup energy systems were in their basements. And so when there was flooding, they didn't have a backup energy system. So like, that's not gonna work. But that's different than how you're talking about it. And the way you're talking about it makes sense to me. And it certainly aligns with issues that we've advocated for. I'm trying to figure out how we could connect that to what our strategies are now, and maybe it is the health systems one. What do you think about job training? Like, should that be incorporated more into our strategies? Because when you were talking about like sector switching, I mean, there certainly is job training that has to go along with that.
Right. I mean, like, yes, and providing systems for like subsidized and free education would go a long way towards like doing that. Making college free for anybody who wishes to get into like an environmentally friendly or green job, including like, you know, teaching or like, you know, community organizing.
That's a good idea.
Or like,
Yep.
Yeah, because I think too often like we get really stuck on these technical things and don't talk about like the social aspects. Like in community resilience, what's the kind of work for like decentralizing our healthcare system so that way like communities always have easy access and thus like reducing their carbon footprint by not having to travel like hours.
They have not, to my knowledge, that subgroup hasn't talked about it. Our subgroup has talked more about the public health system. So being able to access public health nurses, drinking water specialists, safety, like health safety inspectors, because Maine right now has we have positions in statute, but they're not all filled. And so we focused more on the public health staffing as opposed to the healthcare staffing in our subgroup discussion. I think your point about transportation and having to drive far distances to see a doctor is certainly, I mean, a very real issue and certainly is contributing to emissions. I believe that the transportation working group is looking at shared models for that, but I can follow up with them about it. But that's a good point.
Righteous.
And the other part of this too is, and one thing that we have talked about as well is testing for safe drinking water. And not everyone, first of all, can afford to do the test or knows they have to do the test. And then if they find out that their drinking water is unsafe, they may not be able to afford the systems in order to make it safe. And so that also is an issue. And the bank that you were talking about, Becky, I wonder if that could be something that would allow for funding for that, because we've been trying to explore those resources in our other advocacy efforts independent of the Maine Climate Council. It's just amazing to me how many people in Maine don't have clean drinking water. I mean, truly, it's just, it's a little overwhelming. Anthony, what other thoughts or feedback do you have? Because we're meeting again tomorrow as a subgroup, and so I'll circle back with them. And then our working group, like all three of the subgroups, are convening again on Friday. So I'm really appreciating this feedback from you.
Of course, like, yeah, some other questions I have, like, in general, is the working group, like, representative of all communities in Maine? Like, for example, 40% of Maine is under the age of 35. Does the working group, like, accurately reflect that? And education level and, like, racial makeup of the state? Though that one's a little bit more iffy because it's... Yeah.
Age, I think we're close, honestly. We have a pretty young, well, it's a relative term, but yes, we have a pretty young-ish working group. Education level, I'm not sure. I doubt it, but I'm not sure. I think a lot of people have college degrees in our working group and likely advanced degrees like a master's or a doctorate. Race, ethnicity, not very diverse. We have one representative from Wabanaki Public Health, and she's been the only person I think that's been coming to our subgroup meeting. But otherwise, our subgroup is all white. Yeah, like our public health subgroup. So not much with diversity. And then I think you had asked a question about LGBTQ, and we haven't talked about that explicitly. So I'm not sure what the orientation is of the people in our working group.
That's fair.
I do know that there is a I know there's been research looking at homelessness among LGBTQ and related to climate. So I'm aware of that that relationship, but we haven't focused on that in our discussions.
Yeah. I guess and like, oh.
I'm just saying, mindful of the time.
Oh, sure. Yep.
And also, I keep trying to unmute Becky, but I can't. I don't know if you can, Becca, but she has written some things. But Anthony,
I did it.
point.
Sorry. I thought I would make noise, so I muted myself from my own computer. Sorry.
But, Anthony, if you want to finish your point, I just wanted to give us a time check.
Oh,
thank you for
yeah.
that. I lost track, so thank you.
Yeah. I'm gonna defer after this. My last question is just like, how are you ensuring that like when as we roll out these tools that like it's communities in Maine that own it, and like that the people who are pushing for these systems to be implemented are like the folks living on the ground in these communities in Maine, and not like out of state interests or like businesses that, you know, are removing money from our economy.
Mm-hmm. I can't speak for the other working groups about that, but I can with our working group. For example, with the emergency management working group, it's all of the, not all of the planners from all of the towns are there, but the people that are there representing their town are from their town, like they're from Saco or they're from wherever they're working. I don't think it would be fair of me to say that because the town planner from Saco or the whomever from, you know, Portland, because they support it, then now everybody in those towns is going to support it. But
Yep.
but the input is coming from people that live in the communities that they're representing. And certainly there's diversity, like I said before, there's diversity within that, but it's not, the membership of our working group are people from the communities that they're serving in Maine. So I feel comfortable about that with our group. I think you have a really good question with some of the other strategies that are coming out of the other working groups. But ours are focused on, you know, funding for Maine communities, regional or local, if, you know, even sub-regional approaches. That was feedback really loud and clear from the planners, the town planners, which is, you know, totally fair. And one of our priorities as the Public Health Association. So I don't know if that answers your question. The other strategy we have that I didn't talk about is public education, and the whole point being that materials or PSAs or anything that's coming out about climate change, about resources are translated, or there are interpreters available, community health workers are available, you know, people who represent and work with diverse communities are part of that development of those materials and the distribution of them, so that they're accessible. You know, people are able to see what's out there. So
That's good to hear. Yeah.
All right. Thank you, Anthony. Thanks for your feedback.
Thanks, Anthony. This is a great conversation. I don't know if you want to say anything, Becky. I do have a point at the end I also want to add.
I just want to say awesome questions, Anthony. Really great to hear from you about that. And the only other thing that I want to mention was, as part of this plan that we're looking at, is to try to develop an AmeriCorps program that would actually employ a lot of the young people in the state to do this work. So it's not really AmeriCorps. It would be, you know, I don't know what the title would be, but something that we would really
Maine
engage.
Corps.
Yeah,
Maine Corps
or Efficiency Corps, or, you know, to put people to work. You know, I mean, we've been, you know, ruining the fact that we had nobody to do work, and now we have this plethora of people who can work. But we have, you know, we need to, you know, strike while the iron's hot and actually take advantage of this, educate people. You know, it's a huge opportunity if we can just see the silver lining in this horrible black cloud that we're living under. So, I mean, I think a lot of the, you know, things like free education on this kind of stuff, this was tried in Nevada. I've been instructed on how to say Nevada. You know, and everyone who was trained to do this kind of work in Nevada then got full-time work afterwards, after they spent however long it was, I think it was a year, doing this kind of work. So it's, you know, and we have a huge number of houses, we have a huge opportunity to really do work in houses. And I'm, for instance, was able to super insulate my house, and I don't use oil. And I feel like the air quality around me is a lot better. If we could do that in, you know, communities of color, in you know, underserved communities, if we could be doing that, it would make a huge difference in our public health, as well as in, you know, local money staying in the state, you know, $6 billion leaving the state for food and $6 billion leaving for oil. That money should stay in the state and be doing work here rather than lining pockets of other investors. So,
so are you doing that with Sierra Club? Is that what you said, Becky?
That's where we're talking about it, and we're trying to pass the word on. We're going to be talking a little bit about it next Tuesday, and I'll make sure that you hear about that.
Yeah, because I love that idea. I think that that's a fantastic idea.
David,
I'll bring it back to our working group for sure.
Great. David Gibson will send you information about it. He's the one who, you know, has been informing me about it. I've told a few other people, I mean, we as a chapter have told a lot of people about it. I think we're going to, on the 25th of June, we're going to have a work session where we talk about it, you know, with as many agencies as we possibly can. So it'll be a Zoom session. So from 2 to 5 on the 25th of June. And so, you know, I'll be sure that that information is out there, and I don't, you know, Sierra, you can get a hold of us at Sierra Club Maine. It's actually sierraclub.org/Maine will be where if anybody else on the call wants to join, we're really open to have anybody join us on that. So anyway, okay. Thank you. Thank you. I think this is really great. Thanks for letting me share.
Great. Thanks, Becky. If you want to put your information in the chat, you said you'd want to share that. I can try to share that with everyone. I know a few new people have joined. If you have questions, let me know in the chat. You can write your chat there. I think originally we were planning to wrap up now, but if people have a few more minutes, we can continue to see if there's other questions.
I'm happy to do that. I can't see the chat, so
yeah, I will alert
if
you.
Anything pops up.
Yes.
In there. Okay.
So I guess I'm curious about this idea of, you know, this has been a really interesting conversation, but just that I think in the past, we've always looked at things in very, very silos rather than in buckets, and they certainly connect. And after the COVID crisis eventually ends, we certainly are in for another crisis, like on rent and people getting evicted. Like that is an economic crisis, and that triggers so many other things. Mm-hmm. So I'd be curious if the working group is also looking at a definition of what a resilient community really looks like, the different factors, and what triggers. Like there are certainly trends in our state that are positive, but also negative. And so this is where you could catch things before they get too bad, like job training programs, like shifting more people over into the solar industry, or lobster is certainly going to be affected by the warming water. And there's a lot of people in the lobster industry who are now looking at kelp. And is that where, and so what are the job training, what are the opportunities, and what are the types of things that trigger certain types of investment? I don't know if there's a certain thing called climate insurance. Certainly the insurance industry overall thinks climate change is one of the biggest threats to their industry when it comes to flooding or just severe weather. But, you know, our state is very dependent, as Anthony mentioned, on tourism, on fisheries, on guiding, in the restaurant industry, but also winter, winter sports and winter activities and things like that. And that is something that we need to anticipate what that shift kind of looks like, and all of the health aspects that happen after that, and all the economic kind of fallout. So I'm not curious if there's some definition or kind of guidance about that, and then what are the things that we think we really have to be aggressive about in the next, 5 to 10 years, and other types of things that trigger when we don't anticipate it, but we certainly can see.
Yeah, we have not discussed as a working group a definition of resilience or of a resilient community. Like across all of our subgroups. But I think that as we send our strategies to the Maine Climate Council, that we should have that discussion. So we meet again on Friday, and I'll talk with Judy and Annie about whether that should be part of our package, because I think that that's a good framework for both putting forward our strategies, but also for our endorsement of other working group strategies that that would align within our, our subgroups. The one thing that came to mind while you were talking was in public health, we focus a lot on social determinants of health, and that has to do with things like safe and affordable housing, quality education, jobs with a livable wage, social support, safety, like in terms of neighborhood safety. So a whole range of characteristics. And research has consistently shown that where we live is a stronger predictor of our health outcomes than our genetic code. And so in our thinking, it is about creating systems that make it so that people don't have to choose to be healthy. I mean, it should just be in their environment. It shouldn't have to be a matter of moving from one zip code to another or one street to another in order to be safe. And that's the way that we think about it from public health. And so when you're talking about like the next, not the next COVID, but the next disaster, whether it's a pandemic from a virus or a weather-related event that happens, part of prevention is investing in local public health and in these bigger systems like surveillance and monitoring, funding for local communities to be able to have already set up systems in place so that they don't experience the damage that you may see without that investment. And I think our goal would be to have that be equitable. It wouldn't just be the communities that have the tax base that can afford it. It would be available to everybody. But I mean, of course, prevention and investment in systems is important. Yeah, thank you for asking that question.
Thanks, Becca. This has been a great conversation. I don't see any new questions. So we can wrap up. We're a little over time, but it was a good conversation.
Yeah, and I would say to anyone, please feel free to email me. I said before, we're meeting tomorrow as a subgroup, as a public health subgroup, and then Friday's our last bigger working group meeting. And so there's still plenty of time, and certainly even after the strategies are put forward, there's time, but there's even time before then this week to provide us feedback, and it's really helpful to get this. So I want to thank you all for being on today and for choosing this little working group breakout room to provide your thoughts in. This has been great.
And what can you just say your email again, Becca?
Yeah, I'm trying to put it in the chat, but I can't do it to everybody. It's kind of long.
If you do it to me, I will copy.
Oh, okay, great. That's what I'll do.
I thought I could make everyone co-host here, but not so.
When I started this position, it was interim. And so I thought, oh, we'll do a generic email address. And then now, interim turned into 4 years later. And so I have like the world's longest email address.
Wonderful. Well, thanks everybody. We'll send out a follow-up email with the recording and then ways to get in touch and continue this conversation about all of the developing plans from the working groups for the climate action plan. And yeah, especially thanks Becca and Becky and Anthony for the great conversation. But take care.
Yeah, thanks everyone. Thank you.
Take care. Bye.
Take care. Bye.